Hi friends, welcome back to my YouTube channel. So first of all, please subscribe to my YouTube channel. Then coming back to our today's topic is thoracic outlet syndrome. In this video, we will see its definition, its causes, signs and symptoms, types of TOS, investigations and treatment. So let's start the video. Thoracic outlet syndrome is a condition characterized by the compression of nerves, arteries or veins in the thoracic outlet, which is the space between the collarbone and your first rib. Compression of blood vessels and nerves can cause shoulder and neck pain. It can also cause numbness in the fingers. So this is the basic definition of TOS as we will see in this diagram. Now, what are the types of thoracic outlet syndrome? So, there are the three main types of thoracic outlet syndromes. Number one is neurogenic TOS. This is the most common type, accounting by about 95% of cases. It occurs when the brachial plexus, a network of nerves that control movement and sensation in the shoulder, arm, and hand, is compressed. Symptoms include pain, numbness, tinglings, and weakness in the arm and head. Number two is venous TOS. This type of involves compression of subclavian artery of vein, which can result in such as swelling, discoloration, or weak or absent pulse in the arm. The third one is arterial TOS. This is the least common type of TOS. It occurs when the one of the arteries under the collarbone is compressed. The compression may cause injury to the artery and resulting in the bulge and known as an aneurysm or blood clot formation. So they are the three main types of TOS. Now moving towards the cause of TOS. Thoracic outlet syndrome is number one is congenital. Some people are born with extra ribs or tight spaces in their neck, shoulder area, which can increase the risk of TOS. Number two is traumatic. Trauma or injury in the neck or shoulder can cause TOS. Functional issue. Repetitive movements during the same arm movement over and over, like typing or lifting heavy objects, can strain the area. Number four is bad posture. Slouching or holding your shoulder in a weird way can squeeze the nerves and blood vessel. The fifth one is obesity, which puts extra pressure on your joints. So these are the basic cause of TOS formation. Now signs and symptoms. Thoracic outlet syndrome can cause a sign and symptoms depending on the various structure, nerves, arteries and veins and being compressed. Some common signs and symptoms are neurogenic TOS in nerves, pain and aching in the neck, shoulder and arm, numbness or tingling in the arm, hand and fingers, weakness in the arm and fingers, muscle weakness in severe cases. Symptoms worsen with certain arm movement or activities. Now moving toward the next symptoms is venous TOS, swelling or puffiness in the hand and arm, discoloration of the hand and arm, color or color coolness in the hand and arm, weakness or absent pulse in the affected arm, blood clot formation in thrombosis in severe cases. Arterial TOS, a pulsating lump near the collarbone, cold fingers and hand or arms, hand and arm pain, a change in the color in one or more of the finger or in the entire hand, weakness or weak or no pulse in the affected arm. So this is the basic sign and symptoms we will see in three types of TOS, thoracic outlet syndrome. Now, what kind of differential diagnosis of thoracic outlet syndrome? Cervical radiculopathy, rotator cuff pathology, CTS, carpal tunnel syndrome, peripheral neuropathy, vascular disorders, brachial plexopathy, shoulder impingement syndrome, genohumeral joint instability, nerve root involvement, etc. So these are the basic differential diagnoses of thoracic outlet syndrome. Now the next one is investigation. On the basis of TOS, we will investigate on different signs, symptoms, medical history and physical exam. First, we review the symptoms such as pain, numbness and weakness in the neck, shoulder, arm, or perform physical tests, for example, Addison test, Roos test, to reproduce symptoms and assess nerve or blood vessels compressions. Now, the next one is imaging test. Is that how we diagnosed thoracic outlet syndrome is X-ray to check the extra ribs or bone abnormalities, MRI, CT scan to visualize the soft tissues and detect any compression on nerves or blood vessels, because we can see easily on CT or X-ray or MRI. The third one is investigation is nerve conduction studies or electromyography, MEG, measure the electrical activity of muscles and nerves to identify the nerve damage. Now the fourth one is ultrasound, used to visualize blood flow and detect vascular compression in ultrasound. Now moving forward to management and its treatment. Medication, pain relievers such as NSAIDs for pain, muscle relaxant and nerve pain medication for symptoms relief. Lifestyle changes, avoid activities that worsen the symptoms such as heavy lifting or repetitive overhead movements. Improve ergonomics at work and home. The third one is a surgical intervention. In severe cases, when a conservative treatment fails, surgery may be necessary to relieve pressure on affected structures. Surgery for thoracic outlet syndrome may involve are the following: removing a portion of abnormal first rib, releasing a muscle that joins the neck and chest, decompression surgery to remove the structure compressing nerves or blood vessel. These approaches aim to reduce symptoms and prevent further compression. First, we see manage the CTOS with medication or lifestyle changes. Or furthermore, in severe cases, we will manage into the surgical procedure. Now, what are the physical therapy management of TOS? Patient education is the most important is the explain the anatomy of the thoracic outlet and how nerves and blood vessels compression occurs. Teach a proper posture to minimize strains and avoid prolonged overhead activities. Provide ergonomics advice to prevent symptoms exacerbation. Number two is pain management. Manual therapy use techniques to release soft tissue mobilization and joint mobilization to relieve muscle tension and improve mobility. Modalities apply ice, heat, ultrasound, or electrical stimulation tends to reduce pain and inflammation, which is the most important modality we're using in TOS. Moving towards the next approaches is stretching exercises. We perform different exercises like clean stretch, release tension in muscles that can compress nerves, pectoralis minor stretch, reduce compression of the thoracic outlet, levator scapula and upper trapezius stretches improve neck and shoulder flexibility, which is most important to release these tensions. Now the next one is strengthening exercises, scapular stabilization, strengthening muscles like serratus, interior and rhomboid to improve the shoulder mechanics. Postural muscles strengthen neck and thoracic and core muscle for better posture. Resisted exercises use resistance bands or weight to build shoulder greater strength. As we can see in the diagram, we perform different exercises. You can stop the video and take the screenshot and perform your exercises in home. And the next one is postural re-education. Correct forward head posture and rounded shoulder through exercises and posture training. Perform thoracic extension exercises to improve posture and mobility. The next one is neuromobilization techniques. Nerve blinding exercises help mobilize nerves like the brachial plexus or under reduce tension and prevent symptoms. Perform specific lights for median and radial nerves based on symptoms. Activity modification. Advice on modifying or avoiding activities that worsen symptoms and like heavy lifting or prolonged static postures. And the next one is progressive return to activity. Gradually reintroduce previously painful activities such as strength and mobility improved to prevent reoccurrence. Monitoring and re-evaluation regularly reassesses progress and adjusts the treatment plan to ensure continuous improvement and symptoms management. By following these steps, physiotherapy can effectively manage TOS and reduce symptoms and improve function. So this is the short lecture of TOS, thoracic outlet syndrome.